Dr. Jessica Frankenhoff, and I'm here to talk to you about carpal tunnel syndrome. I'm going to talk about what causes it, what can we do to treat it, and what exactly does it mean. So carpus is just a fancy word for wrist. The carpal tunnel is a tunnel in the wrist. It's made up of wrist bones on one side and a ligament across the top. Tendons that control your finger and thumb go through that tunnel. There's also a nerve that supplies sensation to the thumb, index, middle, and half of the ring finger. When there is fluid in the tunnel from tendinitis, so any itis is an inflammation, there's more volume in that fixed space. The bones have no elasticity and they can't expand to accommodate the volume, and the ligament has no elasticity and it cannot expand. So when you have more volume in a fixed space from high school physics, the pressure goes up. The pressure finally goes up so high that it collapses the little tiny blood vessels around the nerve, and you get ischemia, or lack of blood flow to that nerve. And the nerve doesn't like that. It sends out distress signals, and that's what you, the patient, feels as tingling in the fingers. Sometimes you have to shake out your hand to try to get more blood flow, and the tingling will go away temporarily. So what causes it? There are many different reasons. Whatever causes tendinitis. Some people have diabetes, some people have low thyroid, some people it's just repetitive use. It doesn't matter what the reason is, the result is the same. So initially, people have a tendency to only have the symptoms at night. People have a tendency to sleep like this, in the flex position. That puts a lot of pressure on the nerve. So we start out with just carpal tunnel splints. So those are simply wrist splints that you can get at any CVS, Walmart, Target. It keeps the splint in your wrist in extension. And when it does that, you can get better blood flow to that nerve. Eventually what will happen is the splints will stop working, people will wake up from a sleep at night with numbness and tingling in the fingers, or they'll start to get symptoms during the day. For example, people will say, every time I drive, I have to shake out my hand. Every time I talk on the phone, I have to switch hands. Then it's time for surgical intervention.